The Honourable Leader of the New Democratic Party.
Mr. Speaker, the government is spending more than $1,000 per day per person keeping hundreds of long-term care residents living in our hospitals when the cost would be just a fraction of that to have these people living in nursing homes. But instead of that, we've been keeping them in our hospitals, which is causing no end of problems from the point of view of patient flow. And in 5.5 years, the government has not opened a single new nursing home facility. I want to ask the Premier, wouldn't it be better to spend smart up front on a comprehensive program of new nursing home construction than to continue spending stupid on totally unnecessary hospitalization?
Order, please. I'd like to remind the honourable member, the honourable leader for the New Democratic Party, that the word stupid is an unparliamentary term, and I'll ask him to retract that. The honourable leader of the New Democratic Party.
I'd be happy to retract it. Thank you, Mr. Speaker. May I ask, is the word unsmart parliamentary?
What I mentioned earlier is you should not say indirectly what you cannot say directly. So, we'll leave it at that. The Honourable Premier.
I want to thank Mr. Speaker, the member for the question. I also want to thank him for continuing this session to raise the issues that I know he believes are passionate, that are issues that are coming from him that are, impact individual families that not only he represents, that all of us represent. I want to tell him the issue of long-term care is an important one. As you know, as part of the redevelopment in Cabreton, we'll be part of adding long-term care beds, a facility. We're adding additional ones into redevelopment projects that we're having in other parts of the province. We continue to monitor the situation. I also want to tell him one of the things that I've heard loud and clear from my constituents and people across this province is they want to stay home as long as possible. The investments we're making in home care, which we have every budget, Mr. Speaker, that we've introduced, is continuing to support that. But we will continue to reassess where the long-term care beds are required as we continue to make capital investments.
The Honourable Leader of the New Democratic Party.
Mr. Speaker, the government has failed to hire the number of nurses needed to provide adequate care to the patients of the province. Instead, they overran the nurses' overtime budget by $15 million last year in an ad hoc, non-system that is pushing nurses hard in the direction of stress and burnout. Why can't the Premier see that this, too, is a case of failing to spend smart up front, thereby necessitating spending deeply ill-advisedly down the road?
The Honourable Premier.
Thank you, Mr. Speaker. I want to thank the honourable member for the question again. I want to tell him very proud of the investments we continue to make in health care. Mr. Speaker, as you would know, in the earlier question I have with the Leader of the Opposition, physical infrastructure has been allowed to decay in this province through successive governments, making substantial investments. We believe that will not only provide us to be able to provide high-quality care that Nova Scotians are expecting, it will allow us to attract health care providers that want to work in new and modern facilities. And I want to assure the honourable member, as the number of seats that have been added to the nursing schools in our province will continue to add. We'll continue to hire those students. Almost all of them get jobs in Nova Scotia. I also want to tell the honourable member that the nurse practitioner positions that we've added is continuing to heighten the scope of nurses across our province. We are adding family practice nurses in our communities. Those are all important steps, Mr. Speaker. This is a government that recognizes the important role nurses play and the diverse role that nurses play in delivering health care to our citizens.
The Honourable Leader of the New Democratic Party on his final supplementary.
Mr. Speaker, similarly, 33% of pediatric day surgeries at the IWK are related to tooth decay in kids. Children with tooth decay are more susceptible to oral health problems down the road, some of which can lead to increased risk of chronic illnesses, including diabetes and heart disease. If we spent smart by guaranteeing that kids could get their teeth cleaned for free at school, we might not have to be spending so much deeply ill-advisedly later on caring for chronic illnesses that could completely be avoided. So can the Premier explain what the point is of failing to invest up front in prevention at the cost of spending so many millions in mop-up later?
The Honourable Premier.
Thank you, Mr. Speaker. We continue to make investments, Mr. Speaker, providing quality health care to our citizens. The issue the honourable member brings to the floor around dental care for young Nova Scotians, Mr. Speaker, is an important one that we need to make sure that as we invest in providing dental care, Mr. Speaker, it's done in a way that those who require our support the most receive it. There are many kids in this province currently today who have dental plans. Their parents have dental plans. We need to make sure that those who do not, those who are living in socioeconomic disadvantaged circumstances, provide the support of our province, of our government early on, and I look forward to continuing to work with the Dental Association to ensure that we can ensure, Mr. Speaker, that all children have access to that care.